Okay. Good afternoon.
Good afternoon, Doc. We can hear you po.
Uh, Matsuda-san, good afternoon. Did we test your share screen function, Dr. Juno? Yeah.
Yes, Doc.
Can we test your share screen function? Can you share screen now just to check if your projection?
Okay lang po, Doc.
Dr. Juno, are you okay?
Yes, Doc. Okay lang yung video. I mean, yung PowerPoint.
Richard, are you capable of sharing your screen also?
Hello, sir. Hello. Hello, Doc. Sorry. Hello, Doc.
Hi, Richard. Can you share your screen?
Hindi pa ako makapag-share. Ako nagdadrive pa rin
Okay.
ako.
All right, Dr. Juno, can you share your screen? Okay. Thank you, Dr. Juno. Dr. Juno, can you say something so that we can check your microphone?
Sige, Doc.
All right. Thank you. Your audio is coming in clear. Richard, your audio is also coming in clear, but around what time will you be able to project your screen, Richard?
I think I cannot project my screen, Doc.
Okay, so you'll just do an audio presentation, Richard?
Yes, po.
Okay, all right, thank you. Who else are in the call? We have Matsuda-san, we have Kyushu, and Richard. Matsuda-san, what time are we actually starting the session over?
After 1 minute, we will start. We need to start.
Okay, all right. I thought this was the practice already and we were going to have... okay, so we will have... in 1 minute, I will open the session and then I will pass the floor to Dr. Reina Judo Sumatra, and then I will pass the floor to to Mr. Richard Matias as we wait for the other two speakers. Thank you. Matsuda-san, just let me know by giving me a countdown. Thank you.
Excuse me?
Just let me know when we will start and I will start the session.
Okay.
Dr. Juno, please be ready. Thank you. Matsuda-san, let me know if we're good to go. Thank you. Good afternoon, everyone, to the Asia Pacific Advanced Network. I am Dr. Alvin Marcelo. I am from the University of the Philippines, Manila. I am the former director of the National Telehealth Center and currently the director of the Standards and Interoperability Lab. Our network is also part of the Asia OpenRAN Academy. OpenRAN is short for Open Radio Access Network. It is a new protocol that is secure, interoperable, and reliable and resilient. That is a new protocol that we are considering for geographically isolated and disadvantaged areas in the Philippines, or what we call GIDAs or GIDAs. As you all know, like Japan and like Indonesia, the Philippines is an archipelago. We are composed of 7,600 plus islands, and many of these islands are not connected to the internet. Our vision is to have every Filipino connected to the internet and every one of them have access to healthcare through telemedicine, through that internet connection. The offer of Open Radio Access Network of a secure, open, resilient, and reliable internet is very enticing for us. That will be the technology that we think will be able to address the needs of our people in these geographically isolated and disadvantaged areas. Today, we invited several people who are involved in Open Radio Access Network as it is developing in the Philippines. For our first speaker, I would like to call on one of our doctors to the barrios, Dr. Reyna Juno Sumatra, to tell us more about how they are implementing and studying the future implementation of OpenRAN in their community. Dr. Juno, the floor is yours.
Thank you, Dr. Marcelo. I will hold on. I will just share.
We can now see it. Please put it in slideshow mode. Thank you.
Okay.
And we can hear you very well. Go ahead.
Thank you, Doc. Good afternoon. I am Dr. Reyna Juno Uy Sumatra, a rural health physician in the Philippines, currently in partnership with Asia Open RAN Academy, and we are trying to implement the Open Radio Access Networks in my area. So in this discussion, I will present the challenges and opportunities of Open Radio Access Network in geographically isolated and disadvantaged areas in the Philippines. So, as previously introduced by Dr. Marcelo, the Philippines is an archipelago with 7,641 islands divided into 17 administrative regions, 82 provinces, 1,489 municipalities, and 42,029 barangays. Among these, 6,463 barangays are classified as GIDAs. Geographically isolated and disadvantaged areas, or GIDAs, refer to communities with marginalized populations. These areas are often considered GIDAs due to physical and socio-economic factors. This means that they are physically isolated by distance, challenging weather conditions, and difficult transportation routes, including islands, upland, lowland, landlocked, and other hard-to-reach and unserved or underserved communities. Moreover, they are socioeconomically disadvantaged with high poverty rates, and sometimes these vulnerable populations may be in or recovering from crisis or armed conflict. So let's proceed to the challenges of deploying open radio access networks to these GIDAs. We will try to zoom in on 1 out of 82 provinces in the Philippines. Bohol is a province in the Central Visayas region of the Philippines. It consists of 47 municipalities and 1 city, Tagbilaran City, which serves as the provincial capital. Bohol is home to over 1.3 million people. The province is famous for the chocolate hills, its beautiful beaches, and the Philippine tarsier. Bohol has been recognized as a UNESCO Global Geopark. In the province of Bohol, there are 82 GIDAs. These areas are marked on the map. They face unique challenges due to their isolation, socioeconomic challenges, and geographic barriers. The province faces significant gaps in both infrastructure and human resources, particularly in GIDAs. Many health facilities lack necessary ICT infrastructure, such as reliable internet connectivity and adequate power supply, which are essential for telemedicine. We often have rotating brownouts, both scheduled and surprised. The existing equipment is often outdated or insufficient, and there is shortage of skilled ICT personnel to manage and maintain telemedicine systems effectively. In the context of universal healthcare law, telemedicine under building block of health information systems is considered a very important means of delivering high quality and accessible healthcare for all Filipinos. Moreover, the integration and interoperability of electronic medical record systems are limited. This further complicates the delivery of consistent and high quality telemedicine services. This is due in part to the lack of comprehensive local policies and standardized protocols for health information systems, including EMR and telemedicine, which complicates the efforts to integrate OpenRAN systems across different health facilities. These barriers are exacerbated by the challenging geographical terrain and logistical constraints, making it difficult for health workers to provide timely and reliable care to remote communities. Overall, significant investment and strategic planning are needed to overcome these obstacles and fully leverage telemedicine's potential to improve healthcare access in Bohol. Due to time constraints, I will only be focusing on the top 3 challenges. These are limited infrastructure and connectivity, geographical and logistical barriers, and the lack of digital literacy and technical support. So, the first major challenge is the limited infrastructure and connectivity. We conducted an in-car signal testing on the western part of Bohol. As you can see on this map, signal strength varies significantly across the province, with many areas experiencing poor or no signal at all, which is particularly concerning for the deployment of open radio access network systems. So as you can see here, there are areas with no signal and then kind of good signal, no signal, good signal, no good, no good. And usually the areas with relatively decent or good signals are centers of municipalities where good internet connectivity is very important. Since OpenRAN relies heavily on consistent and high-quality connectivity, which is impossible without a good backhaul infrastructure, unfortunately, Bohol's current infrastructure is inadequate, creating a significant barrier to the successful implementation of OpenRAN, especially in the most rural and isolated areas. Without improvements in the backhaul capacity, even the most advanced network solutions will struggle to deliver reliable service across the province. So, hold on, sorry. In addition, GIDAs also lack reliable power supply. So, even if we have good signal, access to telemedicine will also be hindered if the power supply is also not reliable. Another challenge is the geographical and logistical barriers. So this is my site. This is my area, Danao, Bohol. We have 17 barangays and 6 of them are considered geographically isolated and disadvantaged areas. So as I can see here, it's really mountainous and it's There are a lot of clouds in here. It's a pretty common tourist site. It's also called the Sea of Clouds. So the terrain in many GIDAs, as shown in this image, is very difficult to navigate. The rugged terrain and difficult to navigate landscapes in these regions present significant obstacles to building and maintaining traditional network infrastructure. These geographical barriers not only complicate the deployment, but also the ongoing maintenance of essential telecommunication services. Moreover, GIDAs often suffer from power dependency issues as previously discussed. So these restrict the capacity of networks, even traditional ones, from reaching those in the most geographically isolated areas. Furthermore, because of their isolation and because of the socio-economic challenges, these areas often have dependency on specific vendors for specialized components, since there won't necessarily be enough vendors to compete with each other. No, these vulnerable populations are often at the mercy of whichever vendor comes and deliver service, even if the telecommunication service is not at par with standards. These can create bottlenecks and increase costs. Okay, so next I would like to share the primary care provider network. So as you've seen in the picture, we have the mountainous rugged terrain. There is often a lack of regular transportation, which makes it difficult for residents to access essential health services. For most of the indigent population, as you can see here, if this is the rural health unit, this is the main health center, the cost of a one-way trip from the farthest areas is usually about $2 to $3, which is costly, most especially for the indigent populations. This cost barrier, coupled with the difficult journey, discourages many from seeking necessary medical care, even when medications are free at the rural health center. So this, therefore, then becomes an opportunity for improving our telemedicine services, to increase the reach and accessibility of our health services to those who need it the most. And in this way, Open Radio Access Network can provide an alternative option that has less cost and is more cost effective, especially for these areas. Furthermore, just to add a little bit more, the referral process is also time consuming and challenging. So for our health center, so we're here, the nearest referral hospital is 45 minutes away. And depending on the destination, it can take up to 2 hours. So we have about 6 hospitals that we can refer the patients to, but they're all quite far. Even the nearest complete laboratory and pharmacy is still 1 hour away. So that's the situation of the health system in our area. And this is already considering that my area is landlocked or within the island. We can only imagine how hard it could be for island barangays who doesn't have a regular transportation, and their barangay may not have their own sea ambulance. So the challenge just keeps on getting worse. So the third challenge is the lack of digital literacy and technical support. Many communities in GIDAs are not familiar with advanced technologies, and there is a shortage of skilled personnel to maintain and troubleshoot digital systems. So let's say, even if we have a good telemedicine app, even if we have a good telemedicine system, even if the ICT infrastructure has already been improved and the doctors in the health centers are capable, but if the patients themselves are not digital literate and couldn't access the telemedicine service because they don't have their own devices, this is actually a challenge as well, no, to be able to implement a good telemedicine system. So this challenge emphasizes the need for capacity building initiatives alongside the deployment of OpenRAN. So training local communities and healthcare workers will be crucial to ensure the sustainability of these networks. And now, now we proceed to the opportunities. So despite the challenges that have been raised, there are significant opportunities that we can see. So the first opportunity is expanded access to healthcare. So because of the geographic limitations, normal streamlined healthcare itself is difficult to access. So telemedicine will be able to provide healthcare services to these populations living in the most underserved areas and the most isolated communities. OpenRAN can provide the backbone for telemedicine services, allowing patients in remote areas to consult with specialists without needing to travel. So currently, we are in a discussion. So from the barangay to the municipal to the provincial to the regional and the national levels to be able to conduct a proof of concept or more like a case study on how to implement telemedicine, referring a patient from the most rural barangays to the National General Hospital located in Manila. So we are trying to look at how we are going to implement this. Right now, we are still in the process of signing the policies or the memorandums of agreement so that we can see how it goes. And hopefully, it could become a blueprint for the national telemedicine system. So this expanded access could significantly improve health outcomes in GIDAs, where healthcare services are often sparse and difficult to reach. So another opportunity is the cost savings for both patients and providers. By enabling telemedicine, OpenRAN can reduce the need for patients to travel long distances for medical consultations. This not only saves on travel costs, but also reduces the burden on already overstretched healthcare facilities in urban centers, allowing for more efficient allocation of resources. Next, finally, deploying OpenRAN in GIDAs could lead to enhanced local capacity and greater community involvement. By involving local communities in the deployment and maintenance of these networks, we can build local expertise and create jobs. In fact, just merely starting the conversation on open radio access networks deployment in my area, so many developments have already started. No, it has already triggered so many types of development. For example, right now, my area has already started on drafting our ICT plan, which they never had any plans before the project was started. So it's the deployment of OpenRAN has already triggered socioeconomic development in the municipal level. No, we haven't even discussed like how the barangay officials, how the village leaders are themselves becoming empowered because of the upcoming project. They are becoming more digitally literate. They are becoming more aware of the services that they have. And this is very important because the Philippines itself is also shifting towards e-governance. So it's really high time for digitalization. And because some areas are still have limited financial resources, Open Radio Access Network could definitely be a good alternative to be able to ride the digitalization era. So, in conclusion, while there are significant challenges in deploying OpenRAN in GIDAs, the opportunities for improving healthcare access and outcomes are immense. We are only discussing about the application of OpenRAN for telemedicine and health, but there's so much more that could be improved with OpenRAN. By leveraging this technology, we can bring much needed healthcare services to some of the most isolated and disadvantaged areas in the Philippines, ultimately contributing to a healthier, more inclusive society. So thank you for your attention, and I'm happy to take any questions you might have during the Q&A. Thank you.
Thank you, Dr. Judo Sumatra. Please don't leave. We will have an open forum later on. Thank you. Dr. Sumatra actually is a medical doctor. She looks very young. but she is part of what we call in the Philippines the Doctors to the Barrio program. The Doctors to the Barrio program is a more than 20-year-old program designed by the national government to make sure that there are competent, qualified doctors in the remote parts of the country. As you know, these remote parts are not very conducive to practice. So government made sure that there are very good incentives and programs for young doctors to consider spending 3 years in these remote areas. And they are actually doing good work during those 3 years. They are able to mobilize the community. They're able to become leaders, educators, social mobilizers, clinicians, and teachers. So I think they are the inspiration to the areas where they stay in. Thank you, Dr. Judo. Please stand by for our open forum. And so now we'll shift to another speaker who I think will be just using audio. Dr. Judo showed you the data when we performed uh, measurements for the availability of wireless networks in her area and in the province of Bohol. And one of those who helped us is Engineer Richard Matias, one of our specialists at the Asia OpenRAN Academy. So we'd like to hear from Engineer Richard what additional insights from the engineering perspective he might want to share with OpenRAN in geographically isolated and disadvantaged areas. Engineer Richard, the floor is yours. Over.
Thank you, Doc Eloy. Hello, everyone. I'm Richard Machas. First, I'd like to apologize. I cannot do my presentation, but I will be showing. I will be doing a vocal presentation only about OpenRAN. So, earlier this session, Dr. Marcelo and Dr. Juno introduced to you what is OpenRAN, and now it's. I would like to go deeper on the technical part of OpenRAN. So we start on the definition of OpenRAN. So OpenRAN means Open Radio Access Network. And the radio access network itself, in a simple term, it's a cell site. It's a cellular network that is composed of antennas, cables, radios, baseband, and transmission going to the core or the mainframe of the network. So the radio access network is the one that gives us the mobile coverage. This is the one that helps subscribers to connect to the network of different operators or even private entities. Now, what is the difference of this radio access network and OpenRAN? So actually, for both technologies, they can both functions from 2G, 3G, 4G, and 5G. So when we talk about 2G technology, so this is the technology where we started to use SMS or text messages and voice messages. Next is the 3G, where we have experience to do mobile internet, but with decent speed, and at the same time SMS and voice messages as well. And then next is the LTE, where we have a full IP configuration of the network, meaning all the transactions are IP based. And we have reached here up to 100 to 150 Mbps during the first launch of LTE. And now we are in the era of the 5G network, where we have multiple use cases like enhanced mobile broadband, where we could reach up to 10 gigabit per second, URLLC, or the ultra reliable and low latency communications, where the response of the networks are very quick or very fast, meaning we can have a latency as short as 1 millisecond. That is the fastest latency that we can have. And of course, the massive machine type communications, or simply saying it's the massive IoT, or connecting all the things that we connect to the internet. So using the 5G technology, we can have up to 1 million devices connected per square kilometer. So those technologies from 2G, 3G, 4G, and 5G are very essential for connectivity. And the main means to connect to the network is through the radio access network. Now, OpenRAN is of doing a access network. So it has open hardware, open software, and open interface. Compared to the current implementation of radio access network, operators like here in the Philippines, like Globe and Smart, implement the cell site solution or radio access network using a single vendor implementation, meaning they need to buy the radios, the baseband unit from one single vendor in the likes of Ericsson, Nokia, or even Huawei or ZTE. Now, when it comes to OpenRAN, there will be a different interoperability that we can expect, meaning operators can have multiple vendors, equipment vendors from different manufacturers, from the hardware, and at the same time, software. So this means that the network can be implemented by mixing and matching the flexibility of implementing. If they will do that, it will drive down the cost of deployment of a radio access network system. That's why in the GIDA area, since these areas are difficult to justify the business feasibility, or the meaning the rate of investment is very high, so it's very difficult for operators to recover the capital expenditure that they will spend in building this network. So we're looking at OpenRAN because we are seeing in the long run that implementing an OpenRAN, since of this openness and multi-vendor ecosystem, it will have a lower cost of implementation in the long run. In the current implementation of radio access network, like in Japan and in the US, for Japan, Rakuten mentioned that their capital expenditure has decreased from to 30%, and the operational expense is 40% lower than the traditional radio access network. In the US, but they did not mention deployed OpenRAN, that is a dish deploying 4G and 5G network at this technology to deploy LTE in the GIDA area, particularly in Bohol, just to connect those remote areas or geographically isolated and disadvantaged areas going to Manila. So initially, the plan is to connect this GIDA area going to the Philippine General Hospital, where we can also connect the different equipment and have complete management system of all the equipment in the in the PGH, and as well as in the GIDA area. So yeah, so there's a lot of opportunities waiting for OpenRAN, especially here in the Philippines, especially if the two operators will buy in implementing OpenRAN, even in small areas like the GIDA areas that I have mentioned. So yep, so that's an overview of an OpenRAN, and I'll be willing to answer some questions in the Q&A. Thank you, Doc Eloy.
Thank you, Engineer Richard. Please stand by for our open forum. We still have two presenters. Having said that, our next presenter is from the Indian Institute of Technology. I was very fortunate to have spent at least 2 weeks with him when we had a study tour in the US last April. Dr. Kote Kondipu is an expert in Open Radio Access Network, and I'm happy that he is able to join us today to give a talk on the work he's doing on OpenRAN. Dr. Kote, if you can share your screen. Thank you.
Just 1 minute.
Dr. Kote,
Yeah. Are you able to hear?
I can hear you very well, yes,
Yeah,
but we don't see the screen yet.
Yeah. I'm sharing. 1 second.
Thank you.
Sorry. Just 1 minute. I'm just about to share. Cleaning up.
So while Dr. Kote is preparing his slides, he has training in Italy, and I think he can bring in a lot of experience with OpenRAN and also artificial intelligence. So, Dr. Kote, whenever you are ready.
Sir, are you able to see my screen?
I can see it. Please shift to slideshow. Thank you.
Yeah. I mean, just
And we can also hear you. Thank you.
perfect. Yeah. Just maybe what is OpenRAN and also what is the importance for healthcare. Also, it was already discussed by previous panel members. But what we are trying to do is, because now, at least in our labs, how we accelerate the OpenRAN deployment. If you are going again to the ASIC kind of manufacturing, then normally it takes a larger time. Rather than why can't we build something which is very fast enough? Because now these days we have a high-end acceleration cards that are available in the market now, like in FPGAs and GPUs.
Dr.
And
Kote,
yeah, are you able to hear?
we can hear you, but the slides are still on the first page.
Yeah. I still there only. I will
Okay.
move. Yeah.
And it's not yet in slideshow. Thank you.
Yeah.
Go ahead. Thank you. There you go. Thank you. Go ahead.
I am still here in the first slide only, just giving intro, because there are a lot of acceleration components available in the market. Then why can't we use them and do the rapid deployment whenever very specific deployments, basically wherever we need a in-building solutions kind of thing, which is for particular areas like community area. I want to enable a 5G. And you go for ASIC deployment, and that will take a lot of time. Rather than you build a acceleration cards, you just bring them and attach to the any kind of servers, then they are functional. Then the remaining components like the distribution unit and central units, those you can use the software based. The mainly comes for the RU part, and how better RU we can accelerate. If we are able to accelerate the RU, then the deployment of OpenRAN can be faster. For that, we are looking on the different directions now. What is the best way to, and also in this, basically the ORAN consortium in working group 11 is also working on the different parts of the radio unit, how better we can accelerate. This slide basically give us some of the idea. Sorry.
Dr. Kote, we lost your audio.
Yeah, 1 second. My pointer is making me nervous. Yeah. I'm fine now. This is what you see there, right? Like this ORAN unit, basically open radio unit, because once you are able to accelerate this, all the other RAN components are virtualized, most of them. Then it is, you can use any kind of open source on the other side, which is a distribution unit, central unit, and also the open source core networks. Then you just have to virtualize the component install, and they can work in for the rapid deployment. But what is more important is the radio unit. That is where also the United States recently launched a no-full call to expedite the research on the ORU part. The call mainly focuses on the ORU, but what kind of components in this we can accelerate basically. The ORU primarily classified into like 4 areas. One is the RF front end and digital front end, and low-fi and front hole part, which connects basically the distribution unit and other components. If these components, basically they are saying how better we can accelerate. If these components, any of them can be accelerated, the deployment will be very fast, because you don't need to wait. If these all components has to deploy on a particular hardware and you want to build, then where the time is lagging basically. It takes a lot of time, and also each companies that are developing and then they have to go for the factory and manufacturing them and do it. But what is more important thing is, if we are able to do few RF ones where the antenna, except excluding antenna, all the digital front end and the low-fi, if we are able to accelerate into the FPGAs instead of the ASICs. Okay, in case of the FPGAs, you will buy the FPGA device, and whatever the open source available or custom functions, we can just upload them. Then the radio unit is ready for the deployment. Okay, that is where the most of the focus now is devised on the radio unit open source also. The radio unit open source functions, or you can call IP cores, that most of the other research communities are also working on. And some of the cards that you can see, it is from Intel, and also it has a AMD. Lot of industry partners are now working on how to build the fast smart NICs, we normally call them, which will help us to deploy the radio components on the fly. And so you attach these cards to the any kind of servers, then they are ready to work basically. This is some of the research on going on, and at least on the Intel side, and as well as you can see most of the cards here I put from the Intel side. These are the silicon based cards. They are mainly used for running the any kind of virtualized functions, including the virtualized user functions also, and all the front end related activities, which are the low-fi, and if you want to do the frame error corrections and all those things. Now the focus is mainly on building the acceleration cards, which can help us more on the deployment side basically. You can also see in the RU side what kind of components that we can use faster. It has an antenna, you can use it, because these are only acceleration cards. You just simply attach them, because all the functions are inbuilt there. Then it is more easier for the deployment side, because you just have the RF, whatever the spectrum that you want. Then it's faster in the deployment. That is where actually now most of the groups are looking on on working on the faster deployment. How can we emphasize the deployment even faster by deploying the new acceleration cards. These are all the different layers you will have. For the synchronization also, you can use a different card. Otherwise, what we are trying to use currently, we have the PTP like a Thunderbolt and all. There are existing components that we are using them. It is already ASIC based components. Rather than you can buy the FPGA kind of cards, then you can just upload the softwares. Then time synchronization NIC. This is a simple network interface card you can attach to the server. Then this is a simple interface card you can attach to the server. Then you also have one is placed in the server, and this can be also placed in the same server or another server. They can simply connect them. Then it will provide the synchronization rather than using the PTP stamping machines and all those things. Then it's a more faster way of accelerating the deployments. Then the other also, we have some of the virtualization cards that we use. smart NICs. Now we are focusing more on try to, as much as you can accelerate, what kind of layer functions that you can implement, like the all L1 processing, suppose RE mapping, precoding, and layer mapping, modulation, and scrambling, and similarly for the MAC and RLC. These are why I'm stressing them, because this is the cards. They are really helpful for us to, as much as going for the deployment wise very faster. You just buy the N600 card and deploy the software that is there by taken from the anyone. You don't need to wait for the ASIC component and get those hardware and deploy in the areas that are selected. These are very faster way of increasing the deployment phase. Currently, we are also working on where, as I stated below previously, these are the different functions that are there. We are currently implemented, at least in our my lab, all the low-pi is in the is in the FPGA. Then we are next phase that we are moving the digital front end. Then these DAC and ADAC and Lina, all this comes as a IP course. You simply take the existing IP course and integrate with the whatever the other modules that are implemented on the FPGA. Then what happens at the end, all these components can run on the FPGA. You just buy the one FPGA card and take these modules that are available as open source. Suppose you can also deploy on that, then use the antennas and the spectrum for the front-end communication. It really helps on the acceleration on the hardware side. We currently, the second point, one, we understand there is a huge expedite on the deployment side. Not only that, actually, the FPGAs can also bring very much interesting things on the processing time. When I run the radio stack on the CPU side, it takes at least for me more than approximately around 1 millisecond for running the all low-pi, complete low-pi that we are doing. If I run on the FPGA, it takes in the few nanoseconds that you can see here. It is very small, like point not one or point not two, something like that. These are the things we are. Then the one is it give you a better processing time and the high deployment increase, and more importantly, basically the FPGAs, when you're comparing with the GPUs and other next generation acceleration cards, FPGAs provide us very low energy consumptions. That is also more important why the FPGAs need to be. It not only allows us for the rapid deployment, but also it give you the high processing time, low processing time, sorry, and then you also have a low energy consumption. We have a results also for the energy consumption that we determine. Then these are the network functions which I taken from the ORAN consortium. What can be deployed on any radio unit can be classified on the category A and category B, depending on what functions we accelerate. Basically, this whatever you see in the implementation of low-pi and the digital processing unit, as well as the ECP, which is the front hole part. Then all this, then it shows that it can be deployed in the FPGA or not. These are the recommendations that came from the ORAN consortium, basically. Now we are trying to use the recommendations and build a acceleration card that can really help in rapid deployment of the OpenRAN. These are the complete one where our complete goal is, as you see in the red color box here, all these components at the end of the day, it will run on the FPGA. Currently, we are at this one, we completed, and we are also looking to do the front hole part as well as the digital processing. Only RF will be left over, because you can buy any kind of dumb antenna and then integrated with the FPGA, because this is then it will be this is the, as soon as number of antennas you can scale it, and also you can have the RF front end part, then this will be allows to do as much as you need a processing. You just change the card with a more feature, more logic elements, then it helps us on any kind of deployment that takes care. Currently, what I mean, for at least this panel, what I would like to bring basically is that there are some rapid deployments that can be achieved with the help of the hardware acceleration, especially for the radio unit. I'm not talking about the distribution unit and central unit because they are mostly virtualized, and any kind of open source can be also used and integrated with the rapid deployment scenarios. And this will surely allow us an end-to-end fast OpenRAN deployment for any kind of on-the-fly scenarios. It could be healthcare. If you want to enable only couple of buildings, and you just take the acceleration card, put there and some open source components and integrate, and then it allows us the deployment. And it doesn't, you don't need to wait for all the industry products and do the testing and deploy them. This, yeah, that's what where I want to say. There are other slides, basically a lot of them on the, all of them on the acceleration part only. What kind of function that can be implemented on the FPGA fabric, and it comes from the Intel, because these companies are also now focusing very much on the as many as functions that you can offload to the acceleration parts that will really allow us on the deployment phase. That is what I would share my thoughts on the on this. Yeah, because I didn't test much on the healthcare because you all are experts on that. Yeah.
Thank you, Doctor.
That's it. Yeah.
Thank you very much.
Yeah.
Very,
Yeah.
very
Please.
technical presentation. I really like it. Later on, please, if you can stay behind,
Yeah.
I think we have questions from the audience. Thank you very much, Dr. Koti. Good to hear from you again.
Thank
Please
you so
take care.
much.
Take
Yeah.
care of your. I also have
Thank
cough. Okay. So our last presenter, I was with him today in the memorandum of agreement signing for the setup of an interoperability lab at the University of the Philippines. We were also together in a study tour last April with Dr. Koti. He took his PhD in Australia, and I'd like him to share with us developments on the interoperability laboratory at the University of the Philippines. Professor JB de Guzman, the floor is yours. Thank you, Professor JB.
Hello, good afternoon, everyone. You can hear me, right? And you can see the slides.
Yes, to both. Yes.
Okay, good afternoon, everyone. So, I think this is just going to be a very quick, I guess, update, since my colleagues and co-presenters have already presented a lot about the different efforts, the challenges, and then the technology as well. So I'll just be talking about the OpenRAN Interoperability Laboratory that's going to be set up here at the University of the Philippines. Again, I am JB de Guzman from the Electrical and Electronics Engineering Institute at the University of the Philippines. So, USAID, or the United States Agency for International Development, through its Beacon activity, or the Better Access and Connectivity activity, and also the Asia Open Academy, have partnered with the University of the Philippines, uh, again through my institute, which is the Electrical and Electronics Engineering Institute, in realizing the OpenRAN laboratory, which will be housed here at in our institute. And as Dr. Marcelo has already shared with you, so just this morning we attended this event, which was the Memorandum of Understanding signing between UP and USAID for the establishment of the Open RAN laboratory, and as well as the scholarship program, which forms complement to this laboratory. So I borrowed these texts from the Asian Open RAN Academy website, which is also going to be one of the main stakeholders of the laboratory. So the Open RAN laboratory is intended to be a sandbox for innovation, testing, and refinement. So its key features is it's going to be an innovation incubator, wherein it provides resources and also the environment and the ecosystem in developing, brainstorming, and testing different ideas in network technology, specifically in Open RAN. It also serves as a collaborative space wherein we have, again, various stakeholders, of course, the academic as the host. So we as the host, the academic organization, and of course also our our stakeholders from the health, so the works of Dr. Juno and Dr. Marcelo, and also of course the government is also part of this whole endeavor, as well as the industry. So the laboratory which is going to be hosted here serves as that neutral and collaborative space. And of course, it's also going to be used primarily, the laboratory is going to be used for validating technologies, both the ones that are existing, through the different vendors that have been already mentioned earlier, that, vendors of OpenRAN technology, as well as for new technologies, along the research pipeline, the laboratory can also be used for that purposes. And of course, for forecasting in the future. So what's going to be the direction for the industry, in terms of, like the business wise, and also for the research and development wise. So we have adapted a phased approach in establishing the OpenRAN interoperability laboratory. So currently we are at phase one, which is the first year of this phased approach, where the main include together with phase two, which is going to be the upgrades to the foundational phase one. The primary purpose is for workforce development. So primarily demonstrating OpenRAN, and then using the laboratory to demonstrate OpenRAN, not just to the industry, but of course to the students, to the engineers. Since OpenRAN is still a new and upcoming technology, so the knowledge about it is not that. We want to develop the workforce so that the knowledge about OpenRAN can be more understood well. And then on the phase three, which is that is now where we will introduce field trials and use cases, where now we will open the laboratory for the actual testing and validation of, say, for example, different products that are coming from OpenRAN vendors. Although, if you could see here, it looks like the phases are cascaded. We understood that we can actually do the other phases together with, say, for example, we can do phase two and phase three together with phase one, as long as the resources or the budget are actually within reach. So that is also in our consideration. But right now, primarily through the USAID funding, we are able to start and establish the foundational phase. So for the architecture, so the foundational architecture, so we have built this design together with the other technical personnel from the Asia OpenRAN Academy. So the main intention is to create the main intention, or the main purpose, to actually establish this end-to-end system, wherein you have the user equipment or the mobile phones, up to through the radio and the different network elements, up to the core network elements, up to the internet. So we can actually demonstrate that whole end-to-end network. So that's the minimum requirement that we ask that we should have for this foundational laboratory in order to fully demonstrate OpenRAN, and not just OpenRAN, but of course all the other components, the user equipment and also the core components of the whole telco network. So highlighted here. So here are the different OpenRAN components. So you have the radio unit, the distribution unit, and the control unit. And then we also added. We also require that it has to have RAN intelligent controllers. So those the different units as well as the RIC form the main OpenRAN, and of course the core component. So we wanted to make sure that there's also a 5G core, and of course the user equipment, and then the necessary RF chamber, so that we can actually perform experiments within that RF chamber and not interfere with the licensed operators. And in addition to that, of course, we also requested that there should be a UE, or a user equipment emulator, which allows us to actually emulate different scenarios, where, say, for example, you have 500 to tens of thousands of users that are connecting to the network, and then what will happen. So that's one purpose of the UE emulator. And aside from that, we also wanted to include this digital variable attenuator, so that we can vary the strength of the signal, essentially emulating the channel, the different conditions of the channel, between if, for example, you want to emulate like a very far user equipment, say again with the target, with the GIDA areas as the target. So that's one way to do that. And include also the drive test tool, so that we can actually observe what's happening on the user equipment whenever we change the scenarios or change certain parameters. So aside from that, we also have this additional equipment, the spectrum analyzer, which allows us to check the spectrum both over the air and also on the radio units in the RF chamber, and the additional servers, the compute servers that will be necessary in providing the different services or different software that's required in running these different elements, and also in storing the different data for research purposes. So aside from this, so this is the foundational laboratory that's going to be established through USAID. We here at the university would also, for research purposes, would also be augmenting this foundational architecture. So we'll be adding software-defined radios, where we replace the audio unit or the user equipment with software-defined radios, so that we can actually control, control program these radios, so that we can create, again, different scenarios for research purposes. So aside from that, we will also be adding more resources that will allow us to demonstrate other OpenRAN stack. So it's not necessary that the current USAID stack will be using these other OpenRAN stacks. So we also wanted to learn that OpenRAN stack, which would also require additional compute servers. And then aside from that is also another open source core stack. So to augment all these, to have this whole complete understanding for both research and for workforce development purposes. So again, this is still a work in progress. So we are still in the process of procuring the equipment, but just a preview of what is to come. So the current laboratory actually already houses network equipment or telco equipment, which was donated by Nokia. So originally they had, so if you could see here, all this equipment, these are all traditional radio access network equipment that was donated by Nokia. And we originally used this for, demonstrating telecommunications. But with OpenRAN now, so we wanted to upgrade the laboratory, and good thing that USAID is, is also in that direction. So this whole space will now be upgraded. So new equipment will be put there, new servers, new radio units, and all the other additional equipment that will be part of the donation or of the funding from the USAID. And also to complement the laboratory, the telco laboratory, which is now going to be converted into an OpenRAN interoperability laboratory, the university or the institute also has a fully anechoic chamber, which allows us to actually create this camera setups, especially if you have big cameras or not camera, but antennas rather, antenna setups. So if you have large antennas and then multiple antennas that you actually wanted to test, so we have this fully anechoic chamber where we can actually conduct those tests, and have those antennas or radio units connect to the equipment that is on the laboratory. So the fully anechoic chamber is actually just next door. So we can actually do those experiments quite easily using both the fully anechoic chamber and the OpenRAN setup. Okay, so that's for the efforts right now, together with the university on the OpenRAN interoperability laboratory. Now we also have some complementary activities or endeavors that goes hand in hand with the laboratory that's going to be established. So of course, we also ask that, in order to have good or high value workforce, then that workforce has to be research and graduate research trained. So we actually proposed a graduate research program to USAID, and they agreed. And so we were able to get funding for a graduate research program that will actually primarily work on research that is targeted to OpenRAN. So we were able to get funding for 2 PhD students and 1 master's students. And they're actually starting this semester. The semester has started this August. So aside from the graduate research program, we have also formed an ad hoc research committee, which then wrote up a research program with the main goal, or which is also the title of the program, which is Connecting Every Filipino Towards Philippine Digital Transformation, which is composed of 3 sub-projects. So the first project is accessible broadband or 5G for GIDA areas. And then project 2 is on project spectrum usage and coverage analysis for telecommunications. So with the primary goal of analyzing the current spectrum landscape in the Philippines and hoping to improve, both policy and the technology in, managing the spectrum. And lastly is on the contextualized connectivity using enhanced software-defined solutions and OpenRAN. So that's the three component projects of this big research program. So that's another complementary activity. So the intention is to use the OpenRAN lab and of course use the other facilities in the university in realizing these research projects, which again supports all the other different use cases, telehealth, one of them being telemedicine or telehealth. So aside from the research activities, so we are also reaching out with the commission, with the National Commission, which is the National Telecommunications Commission, who manages or regulates, was the mandate in regulating the spectrum. So we actually this is one of the outputs from our activity when we did the study tour in the US earlier this year, where they actually have this innovation zones, which allows experimental licensed usage and allowing researchers to actually conduct over-the-air experiments. So here's an example of that zone. So this is an innovation zone in Manhattan, which is managed by Rutgers, NYU, and Columbia University. So they can actually perform over-the-air experiments in this area. And here's an example of the frequency bands that is publicized by the by the FCC, and what are the type of operation, and then the power, the the transmission power for the fixed station and for the mobile station. So it's specified. So they have created this what you call innovation zone, and we actually wanted to replicate that. So one of the ongoing activities now is actually coordinating with the National Commission so that we will be able to use experimental licenses and perform over-the-air experiments. So here's the current proposal. So this is the map of the campus. So this is where the lab is going to be at our institute, the Electrical Electronics Engineering Institute. And then the National Telecommunications Commission, is housed in a different building, although they are directly under the Department of ICT. So the national government, the National Ministry for ICT is actually located within the campus, luckily. So they're in this side of the campus. And then we also have here one of the research agencies of the Ministry of Science, which is the Advanced Science and Technology Institute. So all three, institutions or agencies are within the campus. So we actually are proposing that the south side of the campus become an innovation zone. So we are, working with the DICT and the ASTI and working with the NTC so that we can realize this innovation zone in the campus. So yeah, so thank you. That is all from our side. So I just wanted to, quickly update everyone on what are the current endeavors that's happening here in the Philippines and specifically in the University of the Philippines, which is specific to OpenRAN. Thank you.
Thank you, Professor. Very exciting developments over there. I hope we can start using the lab as soon as possible when the construction is completed. So we'll shift to the open forum. And for those who have cameras that are available, I'll request if you can turn them on. If not, it's okay. Um, I have prepared questions for each one. I hope that you can address them. And then we'll ask our friends from Kyushu and Temdec if they can also get questions from the audience. We don't see them, but there's actually an audience behind the Zoom room. So for Dr. Juno, you mentioned in a positive way the things that have happened. No? Just talking about OpenRAN and the possibilities of having fast internet in these geographically isolated and disadvantaged areas. What is your wish list? No, once there is a fast internet, open radio access network providing fast internet in your remote areas, what might be in your wish list of the first things you would want to do as a doctor with that available bandwidth with these remote areas? Over.
Thank you for the question, Doc Marcelo. I think if we do have a good internet connection, no, through OpenRAN, another wish I want to have is like adequate equipment for my staff as well. Because implementing for example, the electronic medical records, trying out these things. Even if our healthcare workers are trained, if they don't have the equipment, they will lose it. And then at some point, they wouldn't want to use it because they already forgot how. So one, enough laptops for my healthcare workers for the telemedicine, and enough mobile devices for the community workers. That's what I wish.
Thank you, Dr. Judo. For Engineer Richard, we went around, no, going to the remote places in the province of Bohol. That you also have around other islands in the Philippines. What are the top 3 that we can do to speed up the availability of Open Radio Access Network in these remote parts of the Philippines? And maybe that in also the remote parts of other countries as well. Top 3 recommendations as an engineer.
First, Doc Eloy, is currently right now we have ongoing discussions with DICT. So they want to expand their project on the free Wi-Fi project. And now they're looking at OpenRAN as one of the solutions to augment the free Wi-Fi project. So they call it the Project Orange. So once we have this mobilized, well, there's a lot of steps. Number one is secure a frequency from the National Telecommunications Commission. Now the ICT is requesting two bands. One is the 3.5 gigahertz and the 26 gigahertz. And the other one is the 410 megahertz. So once we have secured this frequency, and the ICT will have a budget of deploying OpenRAN in these areas. So it would be a fast deployment, I will say, because there will be a frequency already, and there's a project that is supported by the government. And then number 3 is to have a good coverage planning, where we could really put a cell site or a tower that is near to the areas where it is needed most. Because previously there are towers coming from operator, but you can see the location are very far from the people. That is because driven by some political issues previously. But we hope that in this project, we can avoid those political issues where we can put the cell sites near to the people.
Thank you, Engineer Richard. Those are very insightful comments. I think good to know that there are things that we can do and we can start mobilizing stakeholders. I think the spectrum important component, as you mentioned, and that's really in many countries, perhaps not just the Philippines, that is more of a congressional concession, and therefore it requires a lot of policy making and lobbying. Once we get that, I think that will really open up the opportunities for many parts of the countries that is still, not getting any type of communication services. Thank you, Engineer Richard. Dr.
Thank you,
Koti,
Doc.
I'm impressed about your lab. You have an AI lab. You're able to do FPGA. You're also able to do, how big is your team in your lab in Darwad? And what are your specialties and competencies? Just to get an idea of
Sure. I can give you the brief basically. My team is around 10 to 12 students are there in the one, and 2 PhDs and 1 master and a lot of undergrad students in the lab. And as a infra side, we have a few SDRs, software defined radios, which X410, which is the 4x4 MIMO SDRs, and also 7-8 high-end servers, the Genon scalable servers, which will basically with R75GD, which is from the Dell. These are basically what we use it for the because now as in the OpenRAN, most of them run as a virtualized components. We now focus more on also on the An experiment runs radio components distribution in central unit at the millicore level, not at the core level, because any system, when you select and deploy the virtualization components, they can be assigned 4 cores or 5 cores system level. I mean systems level resources. But we are also looking on the other end at the millicore level. So whether if a single DU can consume 1,000 millicores, which is a 1 core practically, then you can accelerate 10 DUs, which can connect to the 10 radio units, and you aggregate as many number of DUs as possible. Similarly, for the CU side, this is basically when we have the architecture disaggregated and also the CUPS architecture we call the control and user plane separated ones. Then it helps on that. We have this kind of very high-end servers, which is cost at least $18,000 to $20,000 each. Then we also have the high-end GPUs, which are hardware acceleration cards. I have 44 FPGAs in the lab, which is different features that comes with. Some on IoT space, some on the virtualized RAN function acceleration space, some especially for the AML for networks, where we can do the training on the FPGAs. I have those kind of FPGA cards. And on the GPUs case also, we have 2 H100 GPUs and also 4 A100 GPUs, which are from the NVIDIA. We have a cluster based and we maintain everything, and the users, and most of these features, including the FPGAs, are federated because students can remotely access them and do the experiments, because all FPGAs are connected to the some kind of integrated box, which is a small switch. Then this switch are we build our in-house federation software. Then they can each time they can reserve like one FPGA. Then they get a Python notebook where they can start writing the programs and they can deploy on the FPGAs. Similarly, it happens for all other GPU resources also and the CPU resources also. Most of them are federated, and so students can remotely access everything through we integrated with LDAP, which is basically the each student has a credentials for their email and all. The same can be used for the resource access as well. Yeah, there are multiple set of resources we have in the here. In the ORAN part also, I have recently I'm buying also FluxCon RU and some SDRs along with some mini PCs. Basically, in the lab side, we only do the mini PCs experiment in the showcase labs. When the users comes, we have the showcase lab where we put all with the big screens and we show them. And the backend, all our students use the virtualized resources for the experiment part. Yeah.
So, do you see medical doctor? So I don't understand all of the technology components. Do you see a future where the hardware are now being converted to software? They're getting, and the only hardware in the future might be the radio unit, and the rest is software.
Yeah.
How
far them actually? Yeah, now I think most of the DU and CU are virtualized. Even when we visited US, right, you can see the dish is not in using anymore the DU as a hardware component, because they simply take the DU software from Samsung and deployed in the Dell hardware. Similarly, to the same for the CU also. CU is completely cloud. Basically, the CU is deployed in the cloud infra, which is again the virtualized one. The DU and CU already in the deployment with 100% virtualized deployment. Now, focus is more on the RU as much as they can bring with the low cost devices. That helps also on the faster deployment.
Thank you. Is open at the University of the Philippines. Of course, it will serve the internal of the University of the Philippines, College of Engineering, and also some of the local universities as well that are within the physical geographic area. Are there resources will be available to remote universities that they can tap so that they can also learn from the lab even if they are physically?
Yes, like suppose we thought of doing the MOU with JB, right? Like that I submitted my request to the institute. It takes a bureaucracy things little more here. But as soon as we MOU is signed, I will give the VPN connections. Then the students will get the VPN credentials. They are happy to use any kind of resources existing in our campus. Yeah, it is 100% possible.
Thank you, Dr. Koti. And
Thank
also
you.
for the Guzman in the Philippines, will there be resources accessible remotely for other state universities and colleges? Over.
Mhm. Yes.
Yeah, so similarly, I think we have ongoing through Aora, there are ongoing engagements wherein they actually can, well, they already have agreements with other state universities and colleges and other, not necessarily SECs, but also with private universities, wherein they will actually allow access to the OpenRAN lab as well. And so that's one channel. So through the Asia OpenRAN Academy. And there's also, of course, the direct engagement of the university with other universities as well, both local and international. So we can all just, connect, allow them to connect to the laboratory once it's set up.
Thank you, Professor JB. Any Dr. Judo, maybe just a quick description of the Doctor to the Barrio program, because you are the person that's really experiencing all of these challenges of no connectivity. Maybe just, I described it earlier, but maybe you have a better description because you're actually living out the life of a Doctor to the Barrio. Go ahead, please.
Thank you, Doc Eloy. So, my program, Doctors to the Barrios program, was initiated by Secretary Juan Flavier of the Department of Health, who's also a medical doctor. And he's been part of the rural reconstruction program, basically, back then. The program is already 20 to 30 years, and I'm actually part of the 39th batch of doctors. So, our line of work is really primarily primary care and rural work. So, doctors like me who recently just passed the board exams are deployed to underserved areas. So these are, by criteria, these are fifth to sixth class municipalities without a doctor, or higher class municipalities that has fewer doctors than the prescribed ratio. So our ratio is 1 doctor is to 20,000 population. So that's the current criteria right now. So really, the point of the program is to make sure that Filipinos have access to uh, quality healthcare, no? Because the prevailing statistic right now is that 6 out of 10 Filipinos die without seeing a doctor. And through this program, we hope to be able to ensure that indigent, underserved populations are able to see doctors even without the risk of financial catastrophe. So that's universal healthcare in the Philippines. So primarily, the work that I do, aside from the clinical, is that I actually handle health programs as well. I do a lot of community visits. I do a lot of home visits. For example, right now we currently have an outbreak response. We're closely monitoring dengue outbreak in my community. And we do surveillance, we do epidemiologic response. These are the things that we do. And since we work closely with the rural areas, no, and the rural populations, we see firsthand how it is like when you're really far from streamlined healthcare, when you don't have good access, when you don't have the financial means to be able to access healthcare. So, and then this is also why I tried to reach out to Dr. Marcelo and asked our municipality to partner with Asia OpenRAN Academy, because this is a really good opportunity for us to improve our healthcare services through telemedicine. So that's it, Doc.
Thank you, Dr. Judo. As I told Dr. Judo in our private messages, I'm very impressed with the doctors of the barrios because they are faced with very, very difficult environments with very limited resources, but it is with their perseverance and also ingenuity that they're able to survive. And actually, be of service to the people who would not have access to any doctor at all if not for the volunteers, the volunteer doctors. How many doctors in the barrios do we have right now in the Philippines?
We have about 568 doctors as of April 2024, Doc. Currently, we have 700 plus medical scholars that are going to be doctors to the barrio soon. So we're hoping to expand the reach of these doctors and cover more Filipinos in the Philippines.
Yes, and sometimes one doctor can have three or more geographically isolated and disadvantaged areas. So maybe 500 times 3, 1,500. We will need 1,500 OpenRAN setups, Professor JB, Dr. Koti. If you can start developing a, like a prototype, we can deploy it in the area of Dr. Judo, and then gradually all of the tests that pass through the interoperability lab and are ready for field trials, let us know. We have the doctors who are raring to go and get fast internet to deliver quality healthcare to the people. I saw Dr. Tomohiko earlier on, but I think he left already. So maybe just one round of final words in reverse. We will ask Professor JB and then Dr. Koti and then Engineer Richard and then Dr. Juno. What are your, no more than 1 minute, what are your final words about Open Radio Access Network? Over. Professor JB.
Hi, yeah. So we are actually very, very excited and optimistic about all these current developments and all the support from the different governments as well. And we really look forward in using technology in improving the lives of our, country, of our, of every Filipino, and of course not just in the Philippines, but we also hope to extend the same, to other countries. Thank you.
Thank you. Dr. Koti?
Yeah, it's I am also same, like we are hoping for, but the more interesting thing is in India, we also started last month OpenRAN consortium, basically similar like from the government of India. It is very positive from the government side. They want to really push OpenRAN also in India. Then we have a big project that is launched recently along with the 6G, and they are separate vertical for the only focusing on the OpenRAN. They designed a national-wide committee to look onto the all acceleration deployments, because in India, along with this, we are on the OpenRAN. We also have a smart cities. Government of India launched 100 smart cities, where these 100 smart cities can have an option to deploy the next generation technologies like an OpenRAN. Yeah, thank you.
Thank you, Dr. Koti. Engineer Richard, final words.
Yeah, we're excited to see OpenRAN implementation also here in the Philippines, and implementation in terms of medical use case. And we hope that this would be the start of the deployment together with the operators and other entities here in the Philippines.
Thank you, Engineer Richard. And finally, Dr. Juno.
So for us, Doc, at the field where this technology could be applied, we're really hopeful, no, on all levels. No, I'm really speaking from the barangay level to the municipal level to the provincial to the regional and the national. I've been closely coordinating with them, and it's a resounding positive response. It's a resounding yes for all stakeholders, and I really do believe that health is a right, and this is the way to bring quality healthcare even to those who are in Filipino term nasa laylayan, no, to the most underserved communities. And I do hope we could implement this as soon as we can, but with looking forward to the complete implementation. Thank you.
Thank you. We'll have our photo taken now. But just to thank Dr. Juno for the leadership, getting all of the stakeholders together. That's very challenging, and you've done good work on that, making the soil bed fertile, so that when we plant the OpenRAN seeds, it will take root. So please smile for the camera. Kyushu or Temdeck, are you turning on your camera? All right. 1, 2, ready? Thank you very much. One more with no mask. One more. 1, 2, 3. Thank you, Matsuda-san. Thank you, everyone. Good luck to all of you.
Thank
Bye-bye.
you.
Thank you. Thank
Bye-bye.
you. Bye.
Bye, thank you.
Bye bye.